Hello, my name is Ghassan Boghosian. I'm a board-certified orthopedic surgeon at Desert Orthopedic Center, specializing in minimally invasive hip and knee replacements. I attended San Diego State University and completed medical school at the Lake Erie College of Osteopathic Medicine. I was then fortunate enough to have been accepted to the Cleveland Clinic to attend a subspecialty fellowship in adult hip and knee reconstruction, which focuses on minimally invasive surgery of the hip and knee, revisions of previously implanted replacements, computer navigation, and robotic surgery. The majority of my patients are those in their 5th or greater decade in life who now suffer from arthritis of the hip or knee. After an expedited recovery and close follow-up, pain is gone, they're walking better and doing more. The greatest reward, it's the grandpa who's finally able to get on the ground and play with his grandkids, or that 60-year-old who's able to ski for the first time in 10 years. It's truly a privilege to know that I played a role in that activity.
Speak on this topic once, and he described preparing a patient for surgery as preparing an athlete for an event or a student for a test. And that is no different in our environment today. If you are my patient, I have to prepare you for the operation and the recovery to follow. So how do we do that? Well, we use medications. Again, a multitude of different medications to try to optimize that patient so that their recovery is optimal. Medications like L-arginine, fish oils, turmeric, anti-inflammatory medications, CBD, all of which can help block pain before it starts. Cannabinoids are present in multiple forms. They come in various variations and doses and remedies. And my focus today is to differentiate those that contain THC, that hallucinogenic part of the marijuana plant, from those that are pure medical grade CBD used for medical grade reasons and therapeutics and not to obtain a high. So what is the recipe? Okay, well, it comes in multiple forms. First, CBD. Second, ice. Third, elevation. Fourth, proper movement. And then anti-inflammatories. You see, it takes a lot of things to try to achieve a postoperative recovery with less pain. Not any one of these things alone is going to be effective. You notice that opioids isn't even on the list. Opioids are used in postoperative recovery of a knee or hip replacement, but they're the last option, not anywhere in the front of the options. So what is the difference between CBD and THC? Cannabinoids have been studied for decades, cannabinoids being the active ingredient, well known for their neuroprotective, antioxidant, and anti-inflammatory properties. They're effective in decreasing the perioperative nausea, anxiety, and inflammation. CBD is a non-psychoactive compound found in the cannabis plant. Unlike THC, it does not produce a high. In the plant, there are actually multitudes of different types of CBD. Sorry, multiple types of cannabinoids. But CBD, one particular type of cannabinoid, has been shown to have the most impressive anti-inflammatory properties. This is the mechanism of action. How does it work? Well, it interacts with the endocannabinoid system, particularly the CB1 and CB2 receptors in our body, to modulate neurotransmitter release and influence physiological processes like pain and inflammation. You see, all humans have a normally functioning endocannabinoid system, which is meant to restore the balance and hemostasis to many different functions throughout our entire body. CBD primarily interacts with CB1 and CB2 receptors, which are located throughout our entire body. So you could see there from the diagram that not only in our hip or in our knee, like particular to our discussion today, they actually affect the whole system. There's actually 400 patents in big pharma and 200 plus FDA trials across 26 indications in our pharmaceutical industry. So when you look at those numbers and you look at companies like Pfizer and what's that first one? That's AbbVie, thank you, Sanofi, all these Merck, all these big multi-billion-dollar companies that are taking out patents and looking at clinical trials, you know there's something real there. They're not going to put their money into projects that don't have any fruition. So let me go through some of the clinical evidence. This was surprising to me because when I first started using CBD for my patients and learning more about the topic of CBD, I thought, well, what are the clinical research that's out there and why should this even be a topic for my patients? Lo and behold, there's quite a bit. So I'm going to go through a little bit. So I won't bore you with the particular details, but let's look at what our industry has noticed so far. Keep in mind that we're just starting to get to the point in our industry where research studies are being performed on high-end medical grade CBD, not those unregulated by your local dispensaries. Clinical awareness is certainly on the rise, and research is definitely taking notice. Some researchers have taken notice, including the number of randomized, prospective, well-designed studies, which lead clinicians to make better decisions. Look at all these clinical studies that are available on the benefit of CBD. Interestingly, CBD has also been shown to improve bone growth. Again, more research is noted, but this is a promising start. CBD has been shown to reduce inflammation, as we said previously, by modulation of the CB2 receptors. Researchers have noticed a reduction in the interleukin and tumor necrosis factor, which leads to a reduction in inflammation. Those are the two inflammatory markers that we see elevated in patients with significant inflammation. To my surprise, again, there was an abundance of research focused on clinical efficacy, meaning how well does this drug work, and pain reduction. There are also studies on the reduction of anxiety and improvement of sleep. The science behind reduction of pain is becoming more and more obvious. More focused studies on particular body parts are becoming more important and more prominent. This study demonstrates a significant of improvement in thumb basal joint arthritis related pain. That is the bottom of your thumb, right where it meets your wrist, which is, by the way, one of the most common arthritis in the body. Similarly, in this study, looking at patients related to spinal disorders, they noted that cannabinoids are useful as an alternative to spine disorders and treatment options. In a New York-based study, patients undergoing rotator cuff surgery were noted to have a 23% reduction in pain compared to a placebo. In an American Journal of Sports Medicine article in 2022, they noted a significant amount of promise of CBD in the reduction of pain in the immediate perioperative period after rotator cuff surgery. We're finally starting to see studies looking at the relationship between arthritis and joint pain. This study noted a decrease in patient symptoms as well as a decrease in required medications such as other opioids. We definitely need more orthopedic specific studies in joint replacement. It is exciting to see companies like Organics, who I partnered with, to complete and investigate clinical data looking at CBD and its efficacy as it relates to joint replacement. Here's a prospective study looking at 30, 60, and 90 milligrams for patients receiving CBD compared to placebo. The Organics process is maintained with incredible standards. This is the company that I've partnered with, or DOC has partnered with, because of their medical quality and ethics in testing. It's a USA grown product with medical grade third-party testing. I take comfort in knowing that this is a 100% THC free and therefore compatible prescribing for patients who are, say, policemen, firemen, teachers, others that may be tested on a regular basis. So as a leader in medical grade CBD, the Organics product is available only through the healthcare industry. They follow high grade standards and provide transparency, party testing, and IRB approvals regarding their product. So that, ladies and gentlemen, is CBD in a nutshell. Always my favorite part of getting to meet everybody here is the question and answer session. So this is an opportunity to have an open discussion about what your concerns and comments are. right in the back.
CBD derived from.
Yeah, great question. So in the marijuana plant, there are
Dr.
obviously multiple molecules, right?
Dr. Boghosian, can we, since we don't have a mic in the room, can we,
Repeat the question.
relay the same question for our Zoom audience?
Sure.
That'd be
Got it.
helpful.
Thank you. The question is, what's the difference between the hemp, marijuana, and a CBD, correct? Yeah, so CBD is actually a part of the marijuana plant. So it's extracted from the marijuana plant. And in the marijuana plant, there's actually multiple molecules, and one of them being hemp and another one being THC and another one being CBD. And there's actually different types of CBD, and the one that we're talking about here is a particular type that is really designed or extracted for its anti-inflammatory purposes. Yes.
How do you get that?
Yeah, great question. So a couple of options. Number one, you go on their website. I have documentation here if you want to take with you. So you can go on their website, you can get it on their website, but again, it's through a medical practice. So you can't just go to a website and say, send it to me directly. So what you have to do is you have to use a QR code, and it relates that you're a patient of Desert Orthopedic Center. And then using that QR code, you can actually have it delivered to your house. If your primary is in relationship with Corganics, yes, but I doubt that's the case. It doesn't matter. I'll give you the QR code. You can take it with you. It's okay. Yes.
Find that there's more effectiveness if you add CBG or CBN.
We don't know that yet. So again, clinical research to come, but we have found that CBD is the most effective of the CBs, right? CBG and CBN being another alternative. And we don't know the consequence of adding those two together from a medical standpoint. What we do know is that CBD alone doesn't affect people if they're on blood thinners. We know it doesn't affect them if they have congestive heart failure. We know it doesn't affect them if, they have other conditions. It doesn't seem to play into those negatively, at least. It doesn't seem to have a negative effect on any of those problems. Yes. No, unfortunately, it's not yet. But you saw the patents and the amount of research that's coming down the pipe. And I'll tell you that in the next 4, 5, 10, 15 years, however long it takes for insurance to kind of wake up and smell the pot, if you will, they'll eventually start saying, hey, well, we'd rather pay for CBD than we would for, say, oxycodone or other narcotics.
Dr. Boghosian, what's the last? I'm sorry.
I keep forgetting the question. Thank you. Yes.
But a question that did come up in chat, so they'll know we're listening. We'll have some other questions here. Can you travel with CBD is one question.
That's a great question. So can you travel domestically? Yes, 100%. It's the packaging and the labeling is all approved. And if you from a TSA standpoint, you're fine. But can you travel internationally? Probably not. If you take it overseas, I think they still kind of look at it as being a part of the marijuana plant and may raise a red flag. Yes, sir. I'm not seeing any.
No side effects?
No, I'm not CBD alone. I'm not seeing any. So, I've been prescribing it for about 2 years. The only side effect I hear, the only comment I hear, not side effect, is that I didn't get the amount of relief I hoped to get. And, that brings me to my next topic. The thing that I want to highlight today, I don't want anyone leaving here today saying that there's a great alternative to taking pain medication. That if I had a pain of 8 out of 10 and I take CBD, I'm going to be pain free. I can go golfing tomorrow. No, you're going to be disappointed. So the way these medications work is that CBD, like anything else you saw in that recipe, is a piece of the pie, right? It's going to bring the pain levels down slightly. So CBD may take your pain level down from an 8 to a 7 or to a 6. And whether or not you notice that change is really up to you. Some people will, some people won't. But you add that to another piece of the recipe, say ice and then anti-inflammatories and then elevation, all of a sudden the pain goes from an 8 to a 4. So it works in conjunction with other things to help reduce the pain ever so slightly. Yes, sir.
Hi, I have a question.
You add THC, like an even amount, will that reduce the pain?
Yes. So the question is, if you're taking CBD and add to it THC, my non-medical opinion is, yes, of course, THC is a great pain reducer. And sometimes I do knee or hip replacements on patients who are already using THC, whether they're gummies or whatever else they may be. And they ask me, can I continue to use them? And my answer is, yeah, I think it's probably, again, this is the Ghassan hat, not the Dr. Boghosian hat, probably more effective than the oxycodone I prescribed you in the office. But don't take the two together.
Let's move, Martin, first for 1 second. We have Zoom. Go ahead and ask your question, Sandra.
Yes, we're thinking about what is the dosage that we use for these CBDs? Is it oral? Is it liquid? And how do we administer it?
Great question. I'll repeat the question. I want to highlight one comment I made to the gentleman in the middle of the room. If I tell someone that they can take THC, I'm doing that for two reasons. Number one, because they're already used to it, right? I would never tell Mrs. Jones, who's 89 years old, who's never had it before, to take it. That's a bad idea, right? Also, number two, I make it very clear to that patient that if you're going to take the THC as a pain relief agent, that's fine. Do not take the narcotics along with it, right? It's one or the other. Okay. So the young lady on Zoom asked the question, how do we administer it and what are the dosing suggestions? So you can really take CBD in one of three modalities. Modality number one is in a topical form where you can rub it onto the area that hurts, whether it's your back or your knee or hip, and it absorbs through the skin, transdermally, through the skin and into the area. I think that works well in areas that are relatively superficial and close to the skin. So if your patellar tendon hurts and you have patellar tendonitis and you put it on the skin right in front of the patellar tendon, probably going to work pretty good. If your hip joint deep inside your socket hurts and you put it on the skin, that's too far. It's probably not going to get through that way. The other two modalities or routes of this medication are either sublingual, under your tongue. It comes in an olive oil suspension in a dropper, and you take a dropper full and put it under your tongue for 10 seconds and let it absorb through the blood vessels under your tongue. As you know, that's a very, very highly vascular area. Or a pill that you could swallow. And all three forms tend to work fairly well if you do it fairly consistently. I think the CBD in the olive oil dropper has the highest concentration of CBD. And it's not wrong to take all three. Some patients will actually do the topical. In my post-surgery protocol, it has patients doing all three. They actually start the pill a week before. That helps them with the anxiety. It helps them with the sleep. And then the day of surgery, they use the topical and they use a sublingual in addition to the oral.
Let's take the back.
In the back of the room, yes, sir.
Experience in treating chronic pain.
Me personally, no, but my colleagues at Desert Orthopedic Center use it regularly for chronic pain.
Yes, that would be Dr. Ghassan and
Yep. Dr. Ghassan, Dr. Wong, and Dr. Patel.
thank you. Another question that came in online, and then we'll go to the other, is how can someone who has a different orthopedic physician elsewhere request, like the CBD product you're talking about, and how does that, how do you recommend that they approach that?
Yeah, I mean, talk to them, because every orthopedic surgeon today is being bombarded with this topic, either by their patients or by the industry. The way that I partnered with Corganics is Corganics came to me and said, hey, this is something that your patients are doing anyway. And, I decided to take the bull by the horn, so to speak, and be the one to bring up the conversation rather than the other way around. And, doctors are being asked by their patients about CBD. And I think most of us orthopedic doctors around the country are starting to kind of open our eyes to this other option, especially since there's not many pain medication options on the market today. It's Tylenol, anti-inflammatories, and then narcotics, right? So being that we want to avoid narcotics, we're trying to do everything that we can to move the pendulum away from these terrible medications. And this happens to be one of them.
The follow-up on that same question, is there a topical CBD or is it oral? And
Yeah, there's all three. So there's a topical. I think I have. I'll pass these around. So there's topical, sublingual, and then a pill. So feel free to
look at it, take one, tear it off, pass it down. And the QR code there on the bottom is how you get it if you want to get it.
And for those online, the QR code and the materials he's passing around right now in the room will be available online, and I'll make sure that's part of what you receive during your registration when we have the video ready.
Yes. Okay, so first question was, what's the cost, right? Yeah, got it. So most of my patients aren't chronic pain patients. Most of my patients are going to be, hey, I need I'm post-surgery, so I need a hip or knee replacement, and I'm getting them through that acute phase, that 2-week period or 3 or 4-week period of when they need something for pain relief. And for that, I recommend the combo pack, which is the 3. But for patients who don't have that, say they come in and they have hip bursitis or tendonitis, for them, I recommend 1, possibly 2 modalities, maybe the sublingual and the topical, or the sublingual and the oral. They run about $100 a bottle. I mean, I plus or minus 10 or whatever. And for patients who are doing the post-surgical protocol, which includes all 3, they have a 3-pack, and I think it's $279. Yeah, it does. And and again, we need more research and more clinical data. I would encourage patients who have chronic pain, neurogenic pain, paresthesias, those kind of things, to try it. And you try it for a month, right? You don't want to try it for 2 or 3 days. You're not going to notice anything in 2 to 3 days. But you try it for a month, and if you notice a benefit in a month, then you stay on it. And if you don't, then you don't. Yes, sir.
So numerous dispensaries around have all 3 of the items.
Sure.
That's an option too. Right?
100%. So there are a lot of dispensaries that offer CBD, some of them better than others. The only caveat to that is a couple of things. Number one, you don't know what you're getting if it's not medical grade and medically tested. So if they say it's 150 milligrams of CBD, it might be anywhere from 90 to 220. The other is that you don't know if you're getting any THC in that product or not. For some people, they don't care, and that's okay. And for others who do, it does matter. So the benefit in using a product like this is that you're getting medical grade, pure, clean, medically tested CBD that has no THC in it. And if you're taking a capsule that says 200, you're getting exactly 200.
A follow-up on that, from the question that came up, it's like, how do you know the quality of CBD generally?
Well, that's hard to know, right? So you have to rely on the company that you're working with. And like the gentleman asked, there are dispensaries that offer products that are pretty well regulated and fairly well tested, and others that don't, right? It's merely about making a profit. So you have to trust that the company that you're buying from is indeed providing you a clean product. Yes, sir.
I know in some cases things like opioids or other painkillers can be helped with a stimulant like caffeine. Does that have any effect with CBD? Are you aware? Have you been any research on that?
We know there are medications, correct, that are available in a plus caffeine formulation that doesn't exist yet in the CBD world. Yes, sir.
How would you compare the CBD solution with simple over-the-counter Aleve?
How would I compare the effectiveness of a CBD solution to an over-the-counter Aleve? Yeah, got it.
Which one is going to be?
Well, they're different. So they both have the intent of decreasing inflammation, right? They're both anti-inflammatory medications, but they work by different routes, right? And anti-inflammatory medications, although very effective, can have some pretty significant side effects, right? They can cause cardiovascular issues. They can cause GI bleeds. We're just not seeing that with the CBD. I would tell you that milligram for milligram or dose for dose, I think that the anti-inflammatories are still more effective, right? So if your doctor gave you 800 milligrams of ibuprofen, that's going to probably decrease your pain much faster and much better than, say, starting on a CBD regimen, which could take a week. but it's also coming at a higher consequence of side effects and risk profile. Yeah. We'll go in the front.
Age group probably has several medications we are taking.
Yeah. Yeah, and that's the beauty with CBD, right? And that's the beauty of it, is I've spoken to my cardiology colleagues and I've spoken to the, folks in the CBD industry, the professionals that actually, create and develop and research the product. There does not seem to be any interactions that we've seen yet. Nothing that I've seen yet. Correct. So I'll tell you, like in my office, if I'm prescribing an anti-inflammatory, before I do that, I have to go to the patient's medical history, medication list, allergies, and look to see if there's any consequences in prescribing that medication. With CBD, I don't do that because there doesn't seem to be an interaction with anything else they're taking, if they were taking something else.
One question. What do you have to say about Journavx, I think it is? It was just approved by the FDA for pain. Is there a
Brand new drug, right? I think it's a sodium channel blocker, excuse me. And it's a non-opioid version of a pain medication. Again, hopefully something groundbreaking. I actually have a discussion with a pharmaceutical rep about it on Monday. So I'll learn more about it and see if that's a good alternative for some of our opioid patients.
Thank you.
Too early to tell. I don't know all the side effects of it yet.
In your experience, how important is it to keep the receptors full of the CBD?
That's a great question. What's your name? Hillary. That's a wonderful question because thank you. I'll repeat it. How important is it to keep the receptors full of the CBD? Remember, we're talking about neurotransmitter interactions here. We're talking about stimulating a neurotransmitter by way of a CBD, thereby decreasing interleukins, tumor necrosis factors, and inflammation. And the way to do that is to flood the receptors with this medication. So for someone who's going to take a CBD once on Monday morning, again on Wednesday afternoon, and again on Friday night, and say, yeah, gosh, it just didn't work for me. Yeah, no doubt, it's not going to work, right? I'll give you a personal example. I'll tell you about my life. About 2 years ago, I hurt my back. Muscular strain, my back on a Hawaii trip, yada, yada, supposed to be having a good time. And the first thing I did is I went to CBD. And I did exactly what you're suggesting, which is flood my receptors or flood my body with CBD. I took oral, I took sublingual, and I did topical on my back. And did it make my pain zero? No, of course not. But the combination of that and anti-inflammatory and rest and ice and physical therapy, within about 10, 15 days, I got better. But I believe that part of the reason why I got better is because I flooded my system with CBD and I did it every day for kind of consistently throughout the day. Okay, great question. So how much is too much? The beauty of CBD is that you are going to urinate out any excess CBD. So I was taking 1 pill twice a day. I was doing sublingual 3 times a day. And this is in that regimen that I just gave you. And then I was doing topical about 3 to 4 times a day. So was that more than my receptors could probably transmit? Maybe. I don't really know, but I know that any excess CBD in my system was getting filtered and cleared through my kidneys and ended up in my urine.
Another question. What do you recommend for someone who developed CRPS after total, I'm looking here, replacement in chronic pain?
That's unfortunate. So question is, what do you tell someone who has chronic regional pain syndrome after a knee replacement? This is a very uncommon and incredibly unfortunate complication that happens after potentially any surgery. Didn't have to be a knee replacement. It could have been a gallbladder surgery or a foot surgery. And essentially what happens in that condition is the nerves kind of go haywire after the skin is incised and brought back together. And it causes this kind of burning, tingling, and very, very sharp pain at the skin level. Let me answer specifically with regards to the CBD. There's not enough research to identify the treatment of CBD as it relates to what we call CRPS. When the pharmaceutical industries are starting to take notice of the effectiveness of this drug, the first thing they're going to do is they're going to go after the most common things, right? They're going to go after conditions that are experienced by millions of people. They're not going to go after conditions that are experienced by 1 in a million people. So as we look at things like basal thumb joint arthritis, which is incredibly common in our elderly population, or nonspecific tendonitis or patients with arthritis, those are the conditions they're going to look at first. Get those studies underway. And then as they have more and more data, they'll start looking at more unfamiliar, uncommon conditions. So we don't have a lot of data on that particular diagnosis yet.
Okay, we're waiting. Can you reiterate for some people who joined late on Zoom, the CBD product you were talking about, and the QR code, which we'll be attaching to everything we send out to them?
Yeah.
And how that differentiates between what you're talking about and just a general shop that they may have nearby?
Yeah, the difference between a Corganics type product, and this isn't just one of a kind, by the way, there are medical grade CBDs available by other companies. So I'm not saying this is the end all be all. There are other manufacturers that make medical grade CBD. This just happens to be the one that I've connected with or partnered with or DOC has. This particular product we like for a couple of reasons. Number one, it's medically tested, harvested purely in the US and free of THC. And every pill, if it says it has 200 milligrams of CBD in it, every pill has 200 milligrams of CBD in it. There's no variation. And when you look at, I don't have any bottles here with us, but if you look at each bottle, if you flip it upside down, each bottle has actual certification from the lab in which it was tested by way of a QR code. So you can actually scan that QR code on the bottom of each bottle, and it'll take you right to the diagnostics of that particular batch of CBD that was tested and what its results were. So how is that different from, say, CBD that you get at a dispensary? Many dispensaries have good products because they want their customers to have a good experience, and therefore probably have a product that they have somewhat tested and have some sort of oversight and regulation on. What we don't know is if they can definitively tell you if it's THC free. And what we don't know is the actual milligram that's available in that particular formulation. And companies like Corganics have gone out and obtained some of these particular products, and they've tested, say, a product that has, again, using the example of 200, and there's a variety of dosage in that capsule, anywhere from 90 to 320. So you don't know exactly what you're getting. Again, is that a deal breaker if you're paying half the cost? Because a lot of the stuff you get at dispensaries is cheaper than what you would get at medical grade pharmaceuticals. For some it is, and for some it isn't. The other big factor is the cleanness of the product, right? So again, you don't know exactly what else is in there. And in the Corganics type product, you're getting pure CBD and there's no artificial ingredients in there whatsoever. Even to the point of their sublingual formulation. We had tried other formulations before where they either add menthol or they add other non-active ingredients in their sublingual product. This particular one is 100% extra virgin olive oil. So you have to not mind the taste of olive oil with CBD in it. That is the carrier to the CBD. So there's nothing else in there to make it taste good or to make it fruity or none of that stuff. All right, great questions, guys.
Sorry, my mic went dead. One more question from online. Can CBD help someone with diabetic tendinopathy in his foot?
Yeah, so I would generalize that statement rather than just specifically saying a diabetic tendinopathy. Let me generalize that and say, can CBD help tendinitis? And the answer to that is absolutely yes. And tendinitis is an incredibly common diagnosis, especially things like lateral epicondylitis, the AKA golfer's elbow or the tennis elbow. Those kind of conditions we see on a regular basis. Patellar tendinitis I see in my office quite a bit. So for treatment of those type of conditions, yes, we have seen it be effective and helpful.
And I think I know the answer, but is CBD covered by Medicare?
CBD is not at the moment. I see a day where it will be though. Yes, sir. Yeah, probably.
Someone may have already asked the question.
No.
In order to get the clinical CBD, you need to get a prescription from a doctor.
It's not a prescription. So the question is, in order to get the clinical grade CBD, in this case through Corganics, do you need a prescription from a physician? The answer is no. This is an over-the-counter product. You can walk in and get it. But in order to get medical grade CBD, you have to get it from a doctor's office where that medical grade CBD is available. So in our practice at Desert Orthopedic Center, it's available. You can walk into the building and buy it. You don't have to see a provider. You go into the building at Desert Orthopedic Center, you go to the second floor. When you come off the elevator, you turn right and you go to right off the elevator. It's called the DME store. DME is durable medical equipment. That's where they sell the braces, the ice machines, the walkers, the CBD. So you can walk in there and just straight up pick it up. The other option is you scan a QR code on that piece of paper, and then it asks you, which practice are you quote unquote affiliated with? And you pick Desert Orthopedic Center. It might ask you for a physician name. I'm not sure. In which case you could pick either your doctor's name or Dr. Boghosian or whoever else doctor you want on the list. Again, it's not a prescription. It's just an affiliation. And then you can order it online. And the online price is the same as the store price. I think the only difference is there may be shipping online, shipping costs, but the actual dollar to dollar price is the same.
But an actual question says, and I think they're stating this is like what they've heard, you wouldn't recommend then THC dosage with Corganic CBD?
Repeat the question.
They're wondering if you personally, in your practice, would recommend or not recommend a THC dosage with Corganic CBD.
So would I recommend someone to use THC alongside Corganics? I think that's the question, yeah?
Yes, I think that's.
I think it defeats the purpose. Because if you're using a THC style product, what's the point in spending more money on a THC free product to go alongside of it? So yes, this is medical grade, and yes, I think it's more effective, and yes, I think the dosing is very regulated and tested in various laboratories. But at the end of the day, if a patient of mine is already, say, taking gummies, and that's what they're comfortable with, and their body's used to that, I would be okay with that.
Is there a question in the room? Because I have another one here.
Yes, sir. No, you're good.
There a clinic here on campus.
Yes, there's a clinic here on campus. It's called Desert Orthopedic Center. And Desert Orthopedic Center is right by the cardiology building. You go to the second floor and they have CBD in there as well.
So here's a question that I know comes up because I have done this for my father who's 95. So do you need cash to come to your clinic to buy CBD, or can you use a credit card?
I love that this has become look, I had no intent of you guys coming with a credit card to my office to buy CBD. The intent was to educate you on CBD, but it seems like that's the path this conversation is taking. They do take credit card and they do take cash. Unlike I don't know, in a dispensary, can you even use a credit card or you have to use cash?
Cash only.
I'm impressed that everybody knew that answer. I kind of knew the answer, but I want to see how many of you knew the answer. All right. But because there's no THC in it, the credit cards are fine.
This new product, new to me, CBD. What's the end? How long do you take it? Do you take it till the pain goes away, or do you take it for 6
Well,
months?
first thing is I tell patients, try a single pack, right? So if you're going to do a 2-pack or a 3-pack, whether it's, the topical and the gel or the gel and the pill, whatever it may be, try a single pack. You see the 3-pack up there? Okay, try that, buy it, try it, finish it. And don't make a decision about whether or not you think it helped you until you're done with it, assuming, of course, you're using it diligently, right? Not Monday, Wednesday, Friday, but 3 times a day. At the end of that pack, make a decision. Did it help you? Did it help you enough to spend on that pack $279? Because it may not have worked that well, right? It's a lot of money. Or did it not help you? And if it helped you and it was the best $279 you've ever spent, Now you have to ask yourself, how long do I stay on it? Right? And then that answer depends on the condition that you're treating. So if you're treating a little elbow tendonitis, then maybe you do it for 2 months and you stop and you see how you're doing. Maybe the tendonitis went away. If you're treating a condition that is chronic in nature, like the ones that we discussed earlier today, yeah, you may need to be on it long term.
All right, another question that's very specific, but I'm not sure. When we flood our receptors, does it matter how much we weigh for the dosage treatment for chronic pain?
It's a great question. So the regimen that I use in the office is not weight-based for the patient. So a small patient, large patient, same dosage. It begs the question, though, should a larger patient receive a higher dosage of milligrams? I don't know that we know the answer to that. Again, this is a very early topic and we're still learning a lot about it.
Great. And this goes back to an earlier, is there a question in the room?
Yeah, I think you had a follow-up question, yeah?
Oh, great.
The tri-pack should last you at least 2 weeks. Yes, go ahead, Brett.
Yeah, so the next question is, and I think I got this right. Does this apply to doctors in the East Bay in order to buy it and where? I mean, we talk about obviously here on campus, we kind of laughed about that. But if someone doesn't live anywhere near our campus in Rancho Mirage, how do they go about this?
I mean, if they want the actual Corganics product that we offer, the easiest way is to scan that QR code. And that QR code will take you right to their website. You just have to select Desert Orthopedic Center from the drop-down list. And then you can look at their 3 products online, pick one and have it shipped to your house. That's probably the easiest way. Another way, I'm sure, even if they don't live in the Eisenhower area, maybe they're snowbirds and they live in Denver, go to your local doctor in Denver and ask about it there. I'm sure they have other options. But the beauty of the internet is it could be shipped to you no matter where you live. Yeah. Yes, sir.
Daughter is a physician in Idaho.
Yeah.
It's another country. And GP, can she order as a physician the product and get it from me?
She can. So your daughter is a GP in Idaho, and can she partner with Corganics is the question. Have it brought to her so she can give it to you? Yes, she can.
Carefully, Idaho has very strict laws.
Do they? But again, no THC. So yeah, I mean, the fact that it has, that's why you could. Well, I think across TSA, that's becoming a more accepted product to travel with. And that's why, back to the earlier question, can I travel with it? In the US, domestically, yes, you could travel with CBD, as long as it's clearly labeled that it does not have THC in it.
But but to that point, because having just got back from Europe,
You cannot go
do
overseas.
travel
Not
with
take
that.
CBD overseas.
If nothing else, they will grill you, question you, and you may get away with it, but it just puts a lot of hassle.
Yep.
And then just to reiterate for everybody in the room and everybody, the QR code will be included in the recording. It'll be very evident in the registration that I send out to everybody. That'll probably be within the next 5 to 7 days after we edit this recording.
All right. Well,
All right.
a lot of great questions. I thank you all for your attention.
Thank you all for being here.
And I'll stick around for a few minutes if anyone wants to chat.